Hi, this is Dr. Harris Jensen with a note today of what to do when things get really complicated with women who have depression. So today's story will involve a woman I saw about 6 months ago. And what you get with seeing a psychiatrist is somebody who stands medical issues and how they relate to emotional issues like depression and anxiety. So this woman presented to me feeling really depressed and anxious. Her medicine had been helping, then it stopped working, and she had mental fog. Well, she was also in her uh, late 40s, and so she had symptoms of menopause. She was getting some hot flashes. Mental fog is often part of that. And then she also complained of menstrual bleeding that was just persisting for a week at a time and had never done that before. Just in the last 3 months, 6 months, that had started. And during that time is when her mood dropped down. And so I thought something was going on. What's causing the menstrual bleeding? What's causing the mental fog? She had looked up her antidepressant, which was bupropion, and they're on the internet. You can find anything stupid on the internet. It's the misinformation highway. So she thought bupropion had caused the mental fog. Well, she'd been on that for about 5 years and it had never caused mental fog in the past. So that's pretty unlikely, I let her know. And in fact, I think something was going on with the menstrual bleeding and menopausal symptoms, and maybe it would be good for her to see an OB-GYN and look into those issues, maybe get on some hormone replacement, but also figure out what's causing the excessive menstrual bleeding. She might have some anemia that can cause mental fog, or there might be something else going on. So, uh, what happened was she went to her OB. Uh, Before she could get in with that one, they quit. There's been a lot of turmoil with a lot of doctors quitting and going over to other provider systems. So she had to wait another month. Finally got into an OB. Uh, they did an ultrasound and found she had uterine fibroids. Uh, that was why she had all the bleeding, and she's going to get that repaired surgically. They can't do anything with hormones when she's bleeding like this. So uh, the mental fog now is persisting 6 months later. It's not getting worse. But we didn't go down that rabbit hole of getting rid of her antidepressant that had worked. She's holding her own with her depression with a new game plan. Get the fibroids taken care of, then get the hormone supplements to try to counteract the mental fog of menopause. And so all this happened because she saw a psychiatrist. Well, how could that make a difference? Well, we're trained in how to understand how all the different organs in the body work, and all those organs are eventually connected to the brain. And so she'll get to the bottom of the mental fog, and she'll get to the bottom of why the depression got worse by seeing her OB and gynecologist and getting that taken care of. So that's another reason to see a psychiatrist when things are complicated with your depression. It's not just feeling sad, but there's sadness plus other things. That might be, uh, for some women, menopause, or in this case, uterine fibroids, or any of a number of other issues. And for men, things that can complicate depression include low testosterone levels. Uh, and for those, I refer them to their primary care. Testosterone clinics are often quick to hand out the testosterone, and in some cases, that could potentially increase your prostate cancer risk. So, uh, as in all things, look before you leap with medical care. So, this is an update on interventions that uh, are complicated but useful with complicated depression, where depression is complicated by female hormone and uh, female organ issues. So, have a good day. And if you have complicated depression, give my office a call. Take care.